For 9 long months, brave doctors and nurses across the country have been risking their lives fighting against the coronavirus. Dr. Carlos Araujo-Preza was one of them, treating critically ill COVID patients in Texas, even sometimes sleeping at the hospital in case he needed to intubate ICU patients quickly. But like thousands of other healthcare workers across the country, he contracted the coronavirus in October when cases in Texas started to surge. When his condition worsened, he didn't want to go to the hospital, telling his partner, "I'll go when I think that someone else doesn't need the bed more than I do." It was soon clear he did need that bed, and ultimately the disease he spent months fighting took his life on November 30th. One of Dr. Araujo-Preza's patients told NBC News she is alive because of him, saying, "For him to die from the same thing that he saved me from, I don't think you can make a greater sacrifice." Joining me now, NBC News investigative reporter Mike Hixenbaugh, who reported this story for NBCNews.com, which is dedicating its entire homepage to coronavirus coverage today. And Dr. Dara Kass, an emergency physician at Columbia University Medical Center in New York City, and a Yahoo News medical contributor. Mike, first to you, this is so heartbreaking. Our sympathy with the doctor's partner, his family, but unfortunately this is not a rare occurrence in the pandemic.
That's right. And first of all, thank you so much for spotlighting this story. I think what struck me while reporting it was just the selflessness of this physician and many other healthcare workers throughout this pandemic. You know, Dr. Araujo-Preza was a critical care specialist and a pulmonologist, so he was in high demand. And he was so committed to his patients. As you said, he slept at the hospital for weeks on end early in the pandemic, even on the weekends, so that he could be near the ICU in case one of his patients deteriorated. He would be able to quickly intubate them or provide some other life-saving treatment, waking up 8, 10, 15 times a night for nearly 2 months straight. And of course, his family, his loved ones were so worried for him. And at one point, his partner said to him, "Aren't you afraid of getting this?" And she says his response was, "I'm not afraid. I was born for this." And when you hear someone say something like that, and to have them then months later turn up and be in need of one of those beds, in the same beds where he had treated patients, knowing what he knows about what this disease can do, you can just imagine the fear that he may have felt as he understood the path that he was on. I don't know what you can say about something like that, other than it's just a tragedy. It's heartbreaking.
Well, and it's absolutely heartbreaking. He's so young, so selfless. Dr. Kass, you are one of those frontline workers in New York. You contracted the COVID yourself. Thankfully, you've recovered. First of all, how do you feel? And what messages did you learn to share?
No, I mean, I'm fine. Obviously, for my infection, it's not an issue. I mean, this story is reminiscent of so much we've seen in New York, all over the country. It is happening and everywhere where you're in an ER and you have a member of your staff, a member of your community, sometimes somebody who is in charge, coming in critically ill, and you have to now take care of them. And they know what's going to happen. They know the truth. They know what it's like on the other end. And it is heartbreaking. It is by far the hardest thing we do. And it lasts with us. I just think of all the people that I know who passed from this in our hospitals. And it reminds me how long we've been doing this and the pain we're going to deal with when this is over.
And now we finally have a vaccine. It is going to go to health workers first. Thank goodness. Mike, you reporting that the doctor's partner got an email from the hospital this week that she can sign up for the vaccine. That's probably bittersweet now that he's gone.
I mean,
her loss is so deep.
She got the email offering the vaccine to her as a healthcare worker one day after his funeral on his 52nd birthday. And all she could think was if he could have only avoided this virus for a couple more months, then she may have been setting his favorite black suit aside for a celebration, a night out in the town to celebrate their immunity, instead of delivering it to a funeral home.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.